A classic cause of forefoot pain is the intermetatarsal neuroma. A neuroma, oma means tumor of the nerve. It's not a nerve tumor, but what happens between the metatarsals is that the common digital nerve will become scarred and inflamed, causing symptoms of radiation, tingling, burning, sharp shooting, knife-like or lacinating pain. Very classically, what we see is neuroma in location between the third and the fourth metatarsal, as well as the second and the third metatarsal. The classic Morton's neuroma is pain that occurs between the third and fourth metatarsal, or what we call the third interspace. As we're identifying important anatomy, what we're actually seeing is this is identification of the fourth metatarsal. This is identification of the third metatarsal. And the pain that originates in between those metatarsals up into the web space is very classic. So when we squeeze the metatarsals, oftentimes we'll get a clicking or popping, which is called a Mulder's click. But definitely pain will radiate in between the toes or back from the foot as we do this palpation maneuver. This classic change in the toe position is considered Sullivan's sign. Not everyone with a neuroma will actually have a change in the position, but what we see is we see this split between the third and the fourth toe for this third interspace neuroma, and we can compare this split to the uninvolved side on the right foot to show the difference. Why people develop neuroma has a lot to do with the mechanics of the foot. During walking, our heel and the ball of the foot are the high load-bearing areas of the foot. The heel, which is one bone, takes the impact during walking. The ball of the foot essentially has 5 contact points. We've got the 5th, 4th, 3rd, 2nd, and 1st metatarsal. So direct pressure as we lead our foot into propulsion, where we're lifting our heels off the ground, can increase pressure, causing nerve damage. Side-to-side pressure or narrowness of the shoes can create pinching of the metatarsals. And then intrinsic motion that occurs, or the shearing motion that occurs between the metatarsals, is the third component or potential source of irritation and trauma to the nerve. How we treat people with intermetatarsal neuroma is to really reduce pressure through the ball of the foot. And we use a condition-specific orthotic, which is an arch support with built-in intrinsic padding. And we see this plastic shell orthotic with this pour-on metatarsal padding, and what that does is it'll displace or reduce pressure through the ball of the foot, and the metatarsal padding itself will actually help separate the metatarsals, which will decrease pressure through the nerve. Other forms of treatment for intermetatarsal neuroma is, in fact, anti-inflammatories, ice, oral anti-inflammatories, and cortisone. Cortisone generally is considered a gold standard of care to help decrease the inflammation of the nerve. If cortisone fails, oftentimes we'll use dilute alcohol injections to create scarring and create dysfunction to the nerve to help relieve pain. Outside of conservative measures, we also look at surgery as an option for people who failed this. But classic treatment is using a shoe and orthotic to help reduce pressure, as well as decreasing that side-to-side pressure on the nerve. Again, intermetatarsal neuroma is definitely pain in between the metatarsals and not pain directly on the metatarsals. And it's not associated with swelling on top of the foot.